Hi, Josh. I am so excited that you are here today to talk to me about a topic that you and I are very passionate about, which is the hiring process and how we onboard or recruit new teammates to our respective organizations, and what new teammates can expect during the hiring process and what the organization should be able to expect from that new teammate.
Absolutely. I think for me, the first word that always comes to mind is the word intention. You have an individual and an organization that are both walking in with the best of intentions. And unfortunately, as I'm sure you have as well, we hear about all of the ways that things just kind of fall off the wayside. So with regards to pre-hiring process, like what are some things that HSS is doing to be intentional about making sure that they're starting off on the right first impression?
So I think one of the key things is the philosophy. So the philosophy is that when you are interviewing at HSS, it's a two-way street and it's reciprocal. And it's kind of like a marriage, right? It's got to work for you and it's got to work for us. And when you find that alignment, you have the best fit. I know you and I have talked many times before in the past about core values and culture, but the interview process is critical if you're going to hire the best fit culturally for your organization. So as an example, I think that new teammates who are coming on or potential hires really do need to be prepared. It's interesting to me that people go on an interview sometimes and don't know about the organization or the company. So for anybody who's looking for a new job right now, really in this day and age, you can find information about anything and everything, and you should really come prepared. HSS has a phased approach to interviewing, if you will. So the first phase is kind of the resume review. And especially for new grads, we're looking for things that are not PT related, as you and I have talked about before. Like, we're looking for odd jobs. We're looking for people who have maybe been a team captain, people who volunteer their time. We look for people who have been in the service hospitality industry. Typically, waitresses and bartenders or people who bus, they're dealing with the public all the time. Good or bad, you learn something, even if you're not so great at it. You learn something from doing things like that. So when we go through a resume review, especially for, I think this is super important for new grads, everybody's resume looks the same, pretty much. So what we look for are all those things that are a little different before we go to the next step. What about you?
Yeah, I mean, I'm thinking about everything from coaching sports teams to bartending to the organizations out in the community. Personal training for us, just being in a little bit more of a sports and orthopedic environment, is very, very valuable because the people that walk in to receive a service can be anybody and everyone. And I think that that soft skill, that that emotional intelligence that a lot of people talk about is largely cultivated outside of formal school. All the resumes look the same. You went to college, went to undergrad, you had clinical rotations, you had a couple bullet points at the bottom of each one.
Right.
Great. Talk to me a little bit more on your resume about some of the things that are going to differentiate you. And we've talked about this a little bit. I get more worried about the 4.0 student that's only done one thing, that then comes into our environment and has not experienced other things in life. They haven't had to juggle. I still don't know why a lot of colleges are telling students not to work, because at some point you're going to have more and more things on your plate when you talk about all of the different complexities of life after graduation. So yeah, the resume process, definitely make sure that you're putting more than just your PT school journey on there.
Right. So for us, I couldn't agree with you more, and I think second step for us would be this phone call that we do, which is a screening phone call. And there are some definite no's to this screening phone call. Complaining about your past employer or past work environment, asking about what the salary is and the hours. Like, you don't even know what the job is, so that would be a no. We'll pass. I think the other thing is word choice. If the person on the phone is too I-oriented and not we-oriented, that's kind of a red flag for us. We haven't talked yet about the personal interview, which we'll talk about in a minute, but apropos to what you were saying before, one of the things I think is critical when someone asks you, so tell me about you. Josh, who are you, the person? And they start with this timeline litany. That's not what they're asking. They want to know, what makes you tick? Who are you? What do you like in life? And I think for people who have just done PT, let's just talk about PT because that's what we know best.
Yeah.
Like, that's boring.
Yeah.
That's boring. So what's the next phase for you? After the initial resume screen, what does Rehab to Perform do next?
Well, you reminded me of my favorite question, actually. And I think it really gets into the psyche of the individual, but it is, what does growth look like for you? So it's not just a question of who they are,
Right.
And what is meaningful to them, but it's what does growth look like? Well, you get a good idea of where that person is in their journey, what that short-term snapshot might look for them,
Right.
what that long-term snapshot might look for them. But that's one of the most critical questions that we have during the interview process.
Right.
After that, we want people to come shadow. You know, if they haven't been a student with us, where they get to try before they buy, and I love how you mentioned that earlier, where it is a mutual interview. We want them to spend time with our team, and we use this word all the time, but is the individual passing the vibe check?
Right.
Can they come in and can they interact with everybody on our team? Can they interact with the front desk? Can they interact with some patients? Can they interact with each of our PTs at a given office? Is it a challenge for them to interact? Is there certain things that maybe get picked up on with regards to nonverbal body language, or is something maybe shared that's a little bit more of a less professional conversation point that maybe somebody's kind of like, all right, that person might not understand boundaries quite as well when they're trying to put on their best foot forward. You know, what have you seen during situations like that?
So I think when people are shadowing, so we have that too. If you get invited back, it's usually a 4-hour chunk of time.
Same time.
And is it?
Yeah.
And I think it's important for people to understand as soon as they walk in, they're getting interviewed by everybody. So on purpose, we have you sit in our reception area. And little do you know that Jessica, who is right there greeting you, is part of our interview team. So how you treat the front desk and what you do when you're walking in is super important, right? It's kind of like the mic is always on. And what triggered for me when you were chatting is this, fine line of being confident and not cocky, or being confident or being respectful and not being too friendly. Like, you're on an interview. You can't it's such a fine balance. But similarly, we on purpose bring people in when it's really busy. You meet a lot of different people and tour, and while you're chit-chatting in the hallway and walking around, those individuals are interviewing you. And we're looking for comments like, wow, this place is really busy. And for HSS, that's a big no. HSS is hopping. It is hopping all the time. It's the way the institution works. So if you're coming in on an interview and you think it's too busy, you'll never make it. We're all over. People commute. It's New York City. Someone says, wow, I don't know if I'll be able to do this. The commute's really far. And, so I think there's some things that people pick up on, and then that vibe factor. So all the members of the team have the ability to give a thumbs up or a thumbs down. And if you get a thumbs down, you're done. You're done. And that's because we have spent too many times, trial and error, hiring people who are on the cusp and giving them the benefit of the doubt, like you said, because people come in with the best of intentions, only to find out we put all this time and energy in, and it was a bust. So I would rather pass on the one person that might be the shining star on the 99 that were a bust. So I think that piece is very important, and I think this gets also back to the applicant or the potential teammate having some good questions, because this is important. It's a two-way street, this process, and gets back to them being prepared and asking things about, well, what would my onboarding look like? What are opportunities for me to learn, grow, and develop personally and professionally? And I know you have some really robust things that we have to perform, so why don't you share some of those?
Yeah, no, and I will say, this is just to maybe put a little bit of a plug out there, but I think then it's like after you lock things in with an individual, it's very, very important to make them feel like they made the right decision. So before we even get to onboarding and training, and some of the things that might go through their 90-day or their first year,
well, you know me, I go right to the chase.
I know.
Right to the
we want to
chase.
make them feel like they made the right decision. So we've actually put together like a PDF, like player
Welcome.
packet, welcome packet that's very, 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 very thorough. We want it to be as informative as possible. We don't want any stones to be left unturned, so that when they walk in day one, They really just get to show up and kind of be themselves. Nothing got missed. Nobody from our back office staff is bugging them about something. They're able to really be fully present. I know we have the luxury of doing this also because we're not quite as big, but they get a little box in the mail of company stuff, so it's just a kind of way. Yeah,
swag?
yeah.
Okay,
All right,
okay.
vibe and swag, they kind of go hand in hand, okay? That really, again, it allows them to feel like they made the right decision.
Yeah.
And then the onboarding and training process is another opportunity. Are you intentional enough to create a calendar? Is there structure to what's going on over the first 90 days? Are there certain intervals? What's the cadence? What communication should they expect?
Right.
Largely that first 30 days, we're focusing on a lot of procedural items,
Right.
a lot of operational things. How do you operate within this facility? How do you operate from a timing standpoint? What is going on with your relationship at the front desk? What's going on with your relationship with your site director? What's going on with your relationship with other people at your particular facility? Not necessarily diving into the clinical stuff. And not that the clinical things aren't important, but we want to make sure that this person knows how to function and operate within the clinic, with the people that they're working with every day, and understanding certain timelines and expectations of things like notes and some of the in-services or what they might be contributing to, or how we can kind of pull them in, and I'll get to the in-services in a little bit, but how we can kind of pull them into things that make them feel like they're a little bit more a part of the team. But then that 60 and 90 day is a lot more clinical focus.
Right.
Yeah, we're diving a lot more into chart reviews. We're diving a lot more into case studies, pain points. Maybe we're starting to hear something that's a little bit more individualized and personalized in terms of the need for the individual. This is a mix of both things that are in person, and then we also, we're using some asynchronous modes of communication. We use a platform called Trainual for a lot of like policy and procedural, and then Kajabi with regards to a lot of the clinical side of things.
We went to that too because it's just more efficient. Like we used to have every staff member like give all these in-services.
Yes.
And so it's just easier, I think, for the new hire to listen to them, do them, and then ask questions.
Definitely.
Right, from an efficiency standpoint.
100%. And then they have blocks of time on there. It's like an hour Trainual. Knock it out. We get to see the percentage of progress that they've gone through, ideally 100% at certain intervals. Trainual's the first 30 for us. Kajabi's the 90-day mark. Yeah. And then we have to get into KPIs. At the end of the day, we are going to provide you a lot, but we also have to be able to expect things. There's a reciprocity of expectation.
Correct.
That individual is expecting things from the organization, as they should. We should be able to, as the organization, also expect things from them. And I think that goes kind of hand in hand with some of the challenges maybe that people are having with Gen Z and millennials, but I think largely that's because you're having organizations that aren't potentially being as intentional about what they're providing that young person. So are you doing things for in-services? Are you pairing them up with other individuals in the team that have similar interests or similar pain points? What are you doing this to make this feel more like a team or a family environment so that this individual shows up and they don't feel like they're on an island where it's, hey, much like even DPT students like we were talking about, here's your caseload on day one. Let me know if you need anything.
Right.
That's a situation where that organization lacks intentionality. They're going to not have allowed that person to feel like they made the right decision.
Correct.
And largely, they probably are going to be looking for their exit within a certain period of time already.
Yeah. We actually onboard now for a year, actually. Obviously, less and less intentional after the first 90 days, but with certain touch points along the way. So to keep people, a little bit of a bigger organization, to keep people connected to the hiring process, like you said, and that there's places to go and to discuss things. And then I do something with all the new employees. It's called Coffee and Chat. And now we do it virtually because of where everybody is. HSS is now in 4 states where I get to welcome them, and we get a chance to find out like why HSS, why'd you come? I tell them about my story, and then it's just even a check and balance on, so how is orientation? What went well? What didn't go so well? How can we improve? And I know we've chatted a little bit about the involvement of leadership in creating an atmosphere and a culture where people feel welcome and that they can approach the leader. So this is one strategy that I use so people see me in the beginning, right? Because they may not, if they start in Florida or in New Jersey, I may not have the opportunity to see them.
You walked in without coffee this morning.
I know.
Are you a coffee person?
I am a coffee person.
All right.
I did.
Yeah.
And I think the other thing which you talked about which is, you know, super important. And it does trouble me that people get upset, or I've heard organizational leaders get upset when an interviewee is asking a lot of questions. And I think this is a little bit more aligned with today's generation, but they should ask questions because this is where they're spending a lot of their time, and you want it to be the right fit, because just like you said, if it's not, then you're going to be doing this again. And it's not a good fit for you then, and it's not a good fit for the person, and it costs the company a lot of time and money to have a training mill or a recruiting mill that you are constantly hiring because people are leaving because you didn't hire the right person to start with and you didn't create that bond. And the other thing I'll add, and I want your comments on this, is the sense of purpose. I always think and thought it was important. I think now when I look back in my life, one of the things why I went into the field was to give back, because my purpose was to help people learn and grow, whether that was in a leadership role now or as a PT helping others. But I think people are looking for purpose. They want to know what they're doing is tied to something bigger than themselves and tied to something that makes them feel good about what they're doing.
It makes me think something. I'm definitely becoming much more conscious as our team grows, but learning what makes people tick, right? It's like, what is going to allow them to feel like they have purpose? You know, some people need external recognition. Sometimes people need a little pat on the back. Sometimes people just need you to make time for them so that they know that they are being listened to, or that they're able to ask certain questions. So it looks very, very different for everybody. It makes me think of some of the different things that are out there to get to know your team a little bit more.
Right.
Culture index is one of the things. Colby index is another one, where you get to know your people a little bit more and kind of how they operate, what they think about, what matters to them. And that's something that it's conscious for me right now. I wouldn't say that it's anything that we have like set in stone that really is concrete that we've found to work, but it is something that I'm thinking about more and more. The end of the year survey for us, we started doing a 360 survey, and it actually allows us to put them in a situation to be more reflective and introspective, because they have to evaluate themselves for the beginning part of the end of the year survey. So we're asking certain questions that get us a little bit more into their overall psychology, and I think allow us to kind of track them or connect them, and put themselves in a position where we're either listening to kind of where their career wants to go, or listening to a particular niche that they would like to have supported. Some of these things that allow, especially in a growing environment or an environment like yourself where there's obviously a lot of social capital. It's like, all right, how do we connect this person from a social capital standpoint so that, hey, you want to do workshops over here? Oh, hey, you want to do more talks? Hey, you want to be involved with more of this population base? Okay, boom, here you go. Now we're aligning company purpose, individual's purpose, and there should be, again, this reciprocity.
That's the sweet spot,
That's the sweet spot. It's perfect. So that 360 degree review at the end, where they're reviewing self, review company, they get to review 3 of their peers. It's very, very good feedback that we get. But that's a time where I get a little bit more into the psyche of the individual, and I get to learn more about their purpose and how I can better mesh that with the company.
Right. I think listening, which you do a great job of, is critical. And, the organization has goals, and I think one way that we keep employees and teammates engaged is by giving them diverse opportunities, to learn and grow. And I think the aspect of volunteering with your coworkers is a nice growth opportunity. And on purpose, creating social events or social opportunities where people can mingle and get to know people outside of work are also important, and part of our intention in getting our teams to get to know each other as individuals and people, not just coworkers, is critical. And then I think the other thing that's super important, and you outlined it and I've talked about it in length, is from the onset knowing that there's a career path for you, and the importance of clinical ladders or any type of ladder, whoever comes on your team. Not that it's something you necessarily talk about day one, but they know from the company perspective that on purpose there are things, if they do A, they can get B. And it's not related to longevity. It's related to action and passion and being all in. So why don't you talk about that a little
Yeah,
bit?
no, I think that's one of the things I'm pretty passionate about too.
Yes.
It's like, all right, well, you have young people. How do we incentivize them to hustle? How do we motivate them to hustle, right? Obviously, there's certain monetary things that
Right.
people would like to see, and I think we can all agree the reimbursement's the same for your people, and if they're busy and they're crushing it, there should be certain things that they should be able to see happen to them on a compensation level that aren't. The worst answer for me is, oh, but time. Oh, but you haven't been here long enough. Oh, but you haven't been here 5 years. Like, if you have young people, they want to be connected to the organization, so what better way to connect them than with something monetarily, maybe something from a benefit standpoint, but what you're talking about is largely with regards to career development, career advancement. What can it look like? Can it be residency and fellowship? Could it be something with regards to leadership? For us, could it be, if we open an office, could you potentially be a leader at that office and
Right.
benefit from that? We created Continuing Education Company. Would you like to be involved in teaching and delivering CEs? Would you like to be more involved with the kind of fitness and wellness branch to our company that's evolving? Like,
Yeah.
where do you want to insert yourself that may either be viewed as a more traditional pathway,
Right.
or for some of these people, it's a nice side hustle. They're looking to generate additional revenue,
Right.
which also is going to benefit them on a work-life standpoint. I might work more, but maybe if they work more, they have less financial strain and stress. So for that individual, again, getting back to kind of hearing them, listening to them, being able to understand what matters the most to them, and being able to have a company where, again, we're not quite HSS with all of the different opportunities we have, but we're trying to make sure that we have this ecosystem where individuals can largely see themselves going in different tracks depending on what aligns with their purpose.
Correct. And I think one thing that's key for HSS obviously is clinical excellence.
Yep.
So embedded in our career paths and career journeys are certain levels of clinical excellence, which then correlate to a increase, right? So you're incentivizing, like you were saying, in a different way, people to be OCS or SCS or working to the top of their license and being board certified, or a CHT, something that is publicly recognized as being above and beyond a DPT. Not that DPT is bad, but something above and beyond. And I think it's critically important because only 13 or 14% of all therapists in the country are board certified. So I think that's something, if you talk about trying to differentiate clinically, that's something that's super critical.
Yeah, if anybody wants to get board certified, you can come to R2P. Unless you're at HSS, we won't take you if you're an HSS employee right now. But we do reward people for getting board certified. We take care of the cost of it if they get board certified, to incentivize them to do it, and then it comes with a subsequent raise. We know that board certification is probably one of the biggest issues. Board certification fellowship doesn't lead to increased reimbursement, which is challenging for some people to sit there and go, why would I want to put all this time and energy into it? How am I going to benefit from it?
Right.
That's what we feel like we can do. Hey, if you go through it, we'll take care of the cost. It won't be anything out of your pocket. Obviously, it's initially out of their pocket. You got to pass the test, but then having them see a raise on the back end, I think again, for some people, it fills certain professional cups, and those professional cups are going to be filled depending on what matters most to the individual. But I do think more people should be board certified. I mean, we're early in our residency program.
Right.
We don't have any fellowships yet. Can you share a little bit about kind of what's offered at HSS?
Yeah, so it's interesting. We started actually with a hand fellowship or a hand residency first with the APTA.
Okay.
We started in hand. Carol Page, actually, one of our therapists, was going, I think for her MBA or her master's degree, and needed to do a project. So a lot of the team members that do projects for school do it with us.
Right.
So everybody wins. Like, they do something for the department, which was really cool. And that's really how we started. We started with hands, and then did sports, and then orthopedics, and then over the years now. So that was like in 2006 or 7 we started. So we've been doing this almost 20 years, and then we were lucky enough to partner with some professional teams to do an upper extremity and a lower extremity fellowship for sports, which we have now, that we partner with these local pro teams, which has been like a win-win for us, a win for the organization, so we can provide training for them. And I think this just concept of residencies and fellowships are super important. And one of the things I think HSS can do best is share its knowledge. So we've worked with Stanford Health, we've worked with Ivy Rehab to create residency programs for them that we co-brand. And we just offered one for the first time starting in 2024 for our network. So our rehab network has about 250 different clinics. HSS does not own or operate them. It's like a managed care organization. But we've now offered, for the first time, a residency for our network. So I'm hoping that grows so that we take the burden of the academic piece and the screening and everything that goes into it, the accreditation, and the clinic only has to do the mentoring piece. And I say only, that's a big lift.
Right.
But you don't have to put the whole program together. So we're hoping that we can expand that and help smaller practices and or bigger practices commit to continuing education and the importance of that board certification, because I think that's the only way that it makes a difference. We need more of a critical mass. 12 or 13% kind of doesn't cut it, right?
The site review process and the paperwork associated with residency is not easy.
No, insane,
So, oh my
insane,
goodness.
insane.
Yes.
So I think that's why people shy away.
Yes.
So the idea of maybe partnering or getting a strategic partner to help you, I think is an idea. I know we were talking about new hires and stuff for owners, right? We want to keep them happy, or other organizations who have their leaders. I think that's also critical. I think, just to tie it back even into the new hire, I think when a new hire comes on and sees their company doing new things or growing, whether it will directly benefit them or not, just this concept of, kind of walking the talk, or and seeing that, yes, we believe in growth and we believe in partnering and we believe in working together in new experiences, and then seeing the leadership of that company actually doing different things, right? You didn't have to start a education company. You didn't have to have residency and fellowships, right? You could have been Rehab to Perform and be an awesome outpatient clinic, right? That's awesome.
Yes.
But it's also, for some people want more.
Yes.
And the type of person you're attracting, right? This gets back to culture and values.
You wouldn't be where you want to be if you didn't want more.
Right.
Let's be honest.
No, exactly. So we want people who want more.
Right.
And that's not good or bad. I always have to preface that. That's not good or bad. It's just different environments. And we've talked about this, and tying it back to hiring. It's really important, I think, teammates, new potential teammates really are introspective. Like, what type of environment do you want to be in?
Right.
Do you really want that growth environment where people are hustling and that vibe? And I'm not talking about burnout, but that vibe that people get a kind of like a high because the place is just rocking and it's great? Or do you want this more laid back, one-on-one, super calm environment? Like, that's a great environment too.
Right.
I wouldn't be attracted to it. That's not my personality. I would be bored in like a nanosecond. But that's not me.
I would be as well.
Okay, but that's not me. That's really important, right? There are so many places that physical therapists can work right now.
Right.
We talked about tele before. We've talked about at home. We've talked about in a clinic, a medical center. I mean, it just depends on what experience do you want. You need to really think about that. And what is the cultural vibe? I think not enough people think about the culture of the organization or the core values and making sure they're aligned.
Yes, and I think the word that I found myself hearing as you were going through it is, you have individuals that are intrapreneurs in these organizations. An intrapreneur is somebody that maybe doesn't want to start their own thing. They don't want to do it completely by themselves, or maybe a little bit more risk averse. And they want to come into an organization like HSS and they want to go, hey, I'm willing to put in the sweat. I'm willing to put in the effort. I love it here. I'm happy with my coworkers, but I see all these different ways that HSS is kind of spoking off. I have this interest. What can HSS do for me?
Right.
And that's one of the things where you're mentioning, where not only is HSS doing that for the people in the organization, but it's also starting to do that for people outside, these partner organizations. So I think young people are going to be attracted to that because they largely see a situation where, hey, I could be at HSS, I could get all these benefits, I could get all the benefits of the network, and I could also have all of these benefits of opportunity depending on my interest level or where I'm at in my career. So I think that's That's
Right.
really, really cool. I don't know if you've heard of the word entrepreneur, but I
Yeah.
largely think of some of the people that
Sure.
have come in and helped us start things. They have
Right.
an entrepreneurial mindset.
Meaning
They didn't
they-
want to go to get the startup capital to start the business, but they're willing to be here and be like, hey, here's my idea. We provide company resources, time,
we help
money if we need to, and we mesh that. And
Right.
that's how we've really, I think, able to, keep very, very high achievers who
Right.
might have looked elsewhere, to be honest.
Well, I think that is a great segue into retention,
Yes.
right? Retention is critical. It takes both people to work on creating a place where people can see themselves continuing to grow, or having enough opportunity should they decide they want to change track, perhaps.
Yes.
Is there an opportunity, like you were mentioning your CEU company, somebody decides, hey, you know what, I've been treating for 10 years, maybe I want to treat half-time and teach half-time. And I don't necessarily want to go to a college or try to be an adjunct, but maybe I can do this for the CEU company. So I think, talk to me a little bit about retention and some of the unique things that Rehab to Perform does for retention.
I think retention for me is like it's almost, I think of the word like 2 words, anti-boredom,
Yeah.
right? It's like, how do I make sure that people just can't get bored
Bored.
here, right? Because a bored person is largely, they get disconnected, there's malalignment.
That's kind of like the
it's
quiet quitting,
yes.
right? And they
Yes.
link that to boredom.
And something actually I saw this morning while I was reading, resenteeism, and it was like resentment.
Right.
Like I'm resentful enough to be, but I can't find something necessarily, but I'm just here, and I'm just like, it's like you have a
Annoyed.
very like, yeah, like
A disengaged employee.
correct, yep. So not only are they like
But I'm not
flat,
leaving.
but they're like unhappy, but they just haven't found another opportunity yet,
Yeah.
so they're just waiting for
Or
it.
they're not
So,
leaving, right? Because they
Correct.
don't like change.
But I
so
think
they're
it-
just going to be miserable.
Yes, and in our organization, we call that somebody who's showing up red. We don't want people to show up red. We want them to show up green. They want to.
Okay.
Green means go.
Right.
That green person is going to be their best. They're going to operate at the top of their license. They're going to operate at the top of their personality. They're going to operate at the top of their interconnectivity.
We
It's
talk a
okay to
lot-
be gray a little bit.
Yeah,
but, yeah.
so that translates to HSS is coming in every day,
Yep.
giving 110% as an individual,
Yeah.
and 110% as a team player.
Yes.
Like, that's just the baseline.
Right. And how do you get people to show up
Yeah.
that way consistently? It is some of the things that we've already talked about. It's like, does this individual feel like they're being heard? Does this individual feel like the company is moving in a direction that aligns with them? Are
Right.
things changing?
Right.
Is the environment just dead?
Right.
It's extinct, and people are they're just here because the organization isn't living and breathing. It's not evolving with the times. It's not evolving new opportunities. That individual who doesn't feel heard, they don't feel connected, they don't feel like anything's being created for them, it's almost like they're at a roadblock.
Yeah.
They've reached a roadblock in the organization, they've reached a
Correct.
roadblock in their career, and there's no choice for them to either die here and become that red team, red style player, or leave the organization. So that's why for us it's just so important, like feedback loops, whether or not it's the Q3 check-in, we had a Google form that just went out, end of the year surveys, site director meetings, there's meetings with chief clinical officer, there's bother Josh days where Josh
Right.
shows up to the office and you know that you can bother him for 4 hours. So
I'm signing up for that one.
Hey, that's fine. All right, you can ride the Amtrak down, and I'll let you know what day and where I am.
Yeah.
So, but it's the conversational side of things, and
Yeah.
then if they provide the organization feedback, does the organization actually do
Listen,
something
right,
with it?
right.
Otherwise, they
or
sit
even get
here.
back to them, right? Sometimes
Right.
people give you feedback,
Yep.
and you ask for their opinions, which
Yeah.
are important. Doesn't mean always that you're going to implement their opinion,
Right.
or you're able to do some things. But I think sometimes leaders forget to go back to say, or we took a piece of that opinion and a piece of this opinion and a piece of that opinion and put
Right.
them together. So you contributed, it was great. Or,
Absolutely.
big question. I wish HSS had daycare. It's not happening.
Yeah.
And not because we don't want to.
Right.
It's just that we're in the city, and it's just not something that is going to happen. So you have to explain why. I think it's a
Right.
great idea too, right? I worked and had 2 kids.
Yeah.
I mean, it'd be awesome.
Right.
But sometimes things just aren't possible.
Right.
And I think people forget.
And you can give that feedback, but as long as you took the time to
Right.
then tell this individual, hey, these are the different considerations we went through, and this is why. All feedback is welcome.
Yes.
Not all feedback is good
Good,
feedback.
right.
But as long as you address the feedback, I
Yeah.
think that's another way for people to have also a certain amount of respect and trust in the organization.
Right.
Hey, somebody actually went through
Time.
this, took the time to then have the conversation with me, and
Right.
although I didn't get the answer that I wanted, I at least got something.
Something, right.
So,
So I think, kind of in summary, right, the hiring process is important, probably the most important, right, for you and me, right, because we want to hire the best people. It's super important and just as important for the individual, and it's critical that they make the right choice, and they can only make the right choice with information. And I think looking into it as going into it, I'm going into this as a relationship, right, and I want to be connected, and I want to make sure that the place I'm selecting is as excited to have me as I am to join. So
I would
don't know,
agree.
I
Yeah.
think maybe a few last parting words, because you
Yeah.
always wrap things up better than
No,
me.
I think always it just makes me think of a really, really good marketing funnel. At the end of the day, we want to have patients that we have created awareness through, we have engaged with them, then they've gone through the decision-making process of saying, hey, I'm going to HSS for treatment. Then, once they're in the environment, hey, was this as advertised?
Right.
Is this what I was expecting? Am I able to, if something wasn't quite what I was expecting, am I able to provide feedback? As I'm here, do I need you as much? Do I not need you as much? Is there a way for me to go? My interests have changed. My needs have changed. What can the organization do for me now? So that retention side of things. Not enough people think about the parallel between your marketing funnel for patients or a consumer, regardless of the industry you're in, and what it looks like for your team. And I would argue that the more that we're doing that, we're thinking about how we're creating awareness for talent. How are we engaging and providing them with information? At the time of the decision-making process, what is going on to lock this person in to make sure that they feel like they're in the right place? And then what's going on through the journey of them being an active participation in the organization so that they are going to say, you know what, I can see myself being here for a long period of time.
To build a career and build a journey.
Yes.
Yeah. Josh, I cannot thank you enough. I always enjoy when we chat. Thank you so much for your time.
Thank you very much. Appreciate it.